All right, welcome to another deep dive, ready to explore the world of psych meds.
Always ready to dive into the brain.
Today we'll cover all kinds of psychiatric medications. The different types, how they work, what they do to us, that whole thing.
It's a fascinating area, really shows how complex the brain is.
Totally. It's wild to think, like a little pill can change how we think and feel and act. It's like a key that unlocks this whole universe in our minds. So, where should we start?
Well, you mentioned wanting a good overview, so how about antidepressants? They're super common, but kind of a paradox, right?
How so?
We have tons of them, tricyclics, SSRIs, MAOIs, you name it, but we don't totally get how they actually help with depression.
Wait, really? I mean, even after all the research, that's kind of crazy and a little scary.
It definitely shows there's still so much we don't know about the brain. We have theories, of course.
Like what?
Well, some researchers think antidepressants work through like neuroendocrine pathways. For example, they might lower CRF production,
CRF.
right? It's a hormone big player in the stress response.
So basically, the meds are turning down the body's stress alarm. Makes sense with stress and depression being so linked.
Exactly. Then there's the BDNF theory. That's a protein that helps brain cells grow and survive. Antidepressants might increase those BDNF levels, leading to better brain function, better mood, but the exact how it works is still a puzzle.
So like, if the brain's this crazy complicated machine, antidepressants are tiny wrenches, making adjustments here and there, but we're still figuring out the whole blueprint.
Great analogy. And speaking of figuring things out, did you know the very first antidepressant was found totally by accident?
No way, seriously, tell me more.
Okay, so back in the 50s, doctors were looking for a TB treatment.
Tuberculosis.
Yep, they were using this drug called isoniazid, and they saw this weird side effect. It seemed to make their patients happier. That's how we got MAOIs, the OG antidepressants.
Wow, what a lucky break for mental health. So MAOIs block this enzyme, monoamine oxidase, the one that breaks down certain brain chemicals, neurotransmitters, right?
Right. By blocking it, the MAOIs boost those neurotransmitters like serotonin, norepinephrine, dopamine. Those are all key for mood. But there's a catch.
I think I saw this in my research. Dietary restrictions, right?
Exactly. Foods high in tyramine, that's an amino acid, can be dangerous with MAOIs, like aged cheeses, cured meats, some alcohol.
Yeah, I read about that.
They can cause a big spike in blood pressure. It's a reminder these meds can really help, but they need careful use and monitoring.
Absolutely. So we had those MAOIs first, but then came the tricyclic antidepressants, the TCAs. Those were the go-to for depression for quite a while.
They work kind of like MAOIs, increasing those same mood chemicals, but instead of blocking the enzyme, they stop the reuptake, so the neurotransmitters aren't recycled back into the nerve cells.
So they hang out in the brain longer doing their job.
Yeah, exactly. It can be super effective for many people. However, TCAs can have a lot of side effects, some pretty annoying.
I saw that. Dry mouth, blurry vision, constipation, dizziness. It's a lot.
Right, because they affect other brain systems too, not just serotonin and norepinephrine. One tricky one, especially for older folks, is orthostatic hypotension.
Yeah, I read about that. That's the one where your blood pressure drops suddenly when you hand up, right? Makes you dizzy, might even faint.
Yeah, got to be careful with that one. Always good to talk to your doctor about any side effects that bother you too.
Definitely. Speaking of side effects, let's talk about the stars of the antidepressant world, at least in how often they're prescribed. SSRIs. Seems like everyone's on them these days.
True, they're prescribed a lot, and for good reason. SSRIs, or selective serotonin reuptake inhibitors, they mainly boost serotonin and tend to have fewer side effects than TCAs.
So a more targeted approach to antidepressants?
You could say that, but of course there can still be side effects with any medication. Nausea, insomnia, sexual dysfunction are some common ones.
Right, one of your sources mentioned those sexual side effects.
Yeah, that's something you definitely want to talk to your doctor about. Often ways to manage those, like changing the dose, trying a different med, or other strategies.
Good to know. Then there's SNRIs, sort of a hybrid working on both serotonin and norepinephrine, right?
You got it. SNRIs, serotonin, norepinephrine reuptake inhibitors, often used if SSRIs didn't work or for conditions that might benefit from targeting both, like chronic pain, anxiety, that kind of thing.
It's interesting how those two, serotonin and norepinephrine, are so involved in both mood and how we physically feel.
Really shows how connected our mental and physical health are, makes finding the right treatment for each person even more complex.
For sure. Okay, so we've got MAOIs, TCAs, SSRIs, SNRIs. It's amazing how many kinds of antidepressants there are.
It is, and remember, we're just scratching the surface here. There are others, like the atypical antidepressants, which work in their own ways and have their own side effects.
It's like finding the right pair of shoes. So many styles and sizes out there. Got to find the perfect fit.
That's a great way to put it, and your doctor can help you with that.
Well, before we go shoe shopping, let's switch gears to another important group of psychiatric meds, the mood stabilizers. Mostly used for bipolar disorder.
Good idea. Bipolar disorder with big swings between mania and depression, that's a different challenge for treatment. And meds are key for helping folks find that balance.
Right, let's talk about mood stabilizers. What do we got?
Well, first up, the veteran of the group, lithium. Used for ages for bipolar, especially the mania part.
From what I've read, lithium can be a lifesaver, but it needs careful watching, right?
Exactly. You nailed it. It works wonders, but it has what we call a narrow therapeutic window. Means the dose that helps is pretty close to the dose that can be harmful.
So you got to walk a tightrope, find that sweet spot, and stay balanced.
Perfect analogy. Regular blood tests are key to make sure the levels are safe. And you need to watch out for side effects. Some are common, like being thirsty, shaky, gaining weight, but there can be more serious ones too, like kidney problems if the levels get too high.
So staying in touch with your doctor is crucial.
Absolutely. Okay, besides lithium, we have anticonvulsants. They were first used for seizures, but they're great for bipolar too.
Oh, yeah. I remember reading about those, like multitaskers for the brain handling seizures and mood swings.
Right. They calm down overactive nerve cells so that they can help stabilize mood.
So they're like the brain's peacekeepers, preventing those electrical storms that lead to mania or depression.
I like it.
But I imagine they also have side effects.
Yeah, unfortunately. Some are common: dizziness, drowsiness, nausea, skin rashes, those kinds of things.
Not fun. Any serious ones to watch for?
Yeah, there are some, but they're rare, like liver problems, blood disorders. That's why it's so important with any medication to weigh the good and the bad and find the right fit.
Totally. So lithium and anticonvulsants, those are our main tools for bipolar. Anything else out there?
Yep, there's a newer anticonvulsant, lamotrigine. It's usually well tolerated and can help with both the up and down swings of bipolar.
Always good to have more options, especially for something as tough as bipolar.
For sure. And, many people with bipolar need more than one med to manage their symptoms.
So it's about fine-tuning that brain machine, using different tools to get the balance right?
Exactly. And another thing that comes up a lot with bipolar is antidepressants.
Right. I remember reading about that. Seems like there's some debate on if they're helpful or harmful for people with bipolar.
It's a good debate to have. They can help some people with the depression part, but they also might trigger mania or make the mood swings worse.
A tricky balancing act, then.
Yep. And any decision to use them should be made very carefully with a doctor, someone who can watch for any signs of trouble.
Makes sense. Well, on that note of careful decisions, let's talk about another common mental health struggle: anxiety. I know how tough it can be, but also meds aren't always needed.
You're right. Therapy, lifestyle changes, stress management, those can be really effective for a lot of people.
Totally. But for those who need meds, there are choices, each one working in a different way. It's like a menu of anxiety relievers.
Love that analogy. Speaking of menus, let's start with the fast-acting item, benzodiazepines.
Ah, yes, benzos. They're known for calming you down quickly, good for acute anxiety, like panic attacks.
Exactly. They work by enhancing GABA, a neurotransmitter that chills the brain out, slowing things down.
But I also read they can be addictive, and there's that whole withdrawal thing if you use them too long.
True. They're usually only for short term, and you got to taper off slowly with the doctor to avoid those problems.
So they're like a temporary wave of calm, not a long-term fix.
Right. Now, for something a bit gentler and longer lasting, there's buspirone.
Oh yeah, buspirone. That one stuck out to me. Seems to work differently than benzos.
It does. Takes a bit longer to kick in, but not addictive like benzos. It affects serotonin receptors, but we don't fully know exactly how it works.
A bit of a mystery med then, but potentially helpful for longer-term anxiety. You know what's wild? Some of those over-the-counter antihistamines, the allergy meds, can actually help with anxiety.
It's true. Might seem strange, but think about their sedating effects. Those same effects that make you drowsy can calm anxiety.
So those allergy meds are like secret anxiety fighters. Who knew? Shows that even OTC stuff can have powerful effects on the brain.
For sure. Always good to be mindful of what you're taking and to check with your doc about interactions or side effects.
Absolutely. I think we've covered a lot on the anxiety front. Let's head into antipsychotic territory now. The meds often used for conditions like schizophrenia.
Antipsychotics have changed how we treat psychosis. They help people manage those tough symptoms like hallucinations, delusions, disordered thinking.
And just like with other psych meds, there are different types, right? Each with its own pros and cons.
You got it. We have the first generation antipsychotics, sometimes called typical antipsychotics, and then the second generation, or atypical antipsychotics.
Okay, let's break it down, starting with the first generation. What's the deal with those?
They mainly block dopamine receptors in the brain. Dopamine's a neurotransmitter involved in a lot of stuff: movement, motivation, reward. By blocking it, these meds can help with the positive symptoms of psychosis, like the hallucinations and delusions.
So they're like the dopamine police, keeping those neurotransmitters in check.
Love it. But because dopamine does so much, blocking it can cause unwanted side effects, the extrapyramidal side effects.
Yeah, I saw that term, extrapyramidal side effects. Sounds kind of intense. What are they exactly?
They can be pretty annoying, yeah. Mostly movement problems like Parkinsonism, dystonia, akathisia.
Okay, let's define those for our listeners. So Parkinsonism is like having Parkinson's-like symptoms, tremors, stiff muscles, slow movements. Dystonia is when muscles contract involuntarily, can be painful. And akathisia is feeling super restless, like you can sit still.
Perfectly explained. Important thing is those side effects can often be managed by adjusting the dose or adding other meds to counteract them.
Good to know. So first-generation antipsychotics can work for psychosis, but they come with a higher chance of these movement issues. What about the second-generation ones? Are they better in that way?
They often are, yeah. Lower risk of those extrapyramidal side effects. They work a little differently, affecting both dopamine and serotonin receptors.
So they take a more balanced approach, targeting multiple systems to get the effects you want, but with fewer side effects.
Exactly. But it's important to know they come with their own potential side effects, like weight gain, metabolic syndrome, and increased risk of other health problems.
So, like with everything, it's about balancing risk and benefits.
You said it. It all goes back to personalized treatment, working closely with your doc to find the right meds and the right dose for you.
For sure. Well, we've covered a lot of ground here, from antidepressants to mood stabilizers to anxiety meds to antipsychotics. These medications can be powerful tools for managing mental health, but they have to be used responsibly and carefully.
Couldn't agree more. And before I move on, I think we should touch on over-the-counter supplements and herbal stuff. They're often marketed as natural alternatives for mental health.
Oh yeah, I've seen tons of that in my research. St. John's wort, valerian root, melatonin, the list goes on. But I also read that these products can be a bit of a free-for-all in terms of regulation and safety.
That's the thing. People are drawn to natural remedies. They seem gentler than prescription meds.
I get that, but the lack of regulation is scary. You don't always know what you're getting. Could be contamination, interactions with other megs, you just don't know.
Exactly. Some people find relief with herbal products, but you got to be careful, do your research, and talk to your doctor to make sure they're safe and right for you.
Good point. That's a perfect transition to talk about some exciting new treatments for mental health that are coming up. There's some really cool stuff on the horizon from what I read. Ready to peek into the future of psych meds.
Always. Let's explore those cutting-edge treatments.
All right, lead the way.
All right, so ketamine therapy. You've probably heard of it.
Oh yeah, ketamine, the drug that's both a party drug and a potential game changer for depression. Pretty wild, right?
Totally. It's usually used as an anesthetic, for surgery or in emergencies. But now researchers are seeing its crazy ability to rapidly relieve depression, even in people who haven't had luck with other treatments.
Like it's a secret weapon for those who've kind of given up hope?
That's a good way to think about it. What's really cool is ketamine works differently than those typical antidepressants. It targets a whole other system in the brain, the glutamate system.
Glutamate, that's involved in learning and memory, right?
Yep, and neuroplasticity, too.
Neuroplasticity, that's the brain's ability to change and adapt, right?
Exactly. So the idea is ketamine, by increasing glutamate activity, it might actually help brain cells grow and connect better, like rewiring the brain to help with depression.
So it's not just hiding the symptoms, it's going after what's causing the depression in the first place.
That's what we're thinking right now. Really promising stuff, but I gotta remember, it's still early days for ketamine therapy. We need more research to really understand those long-term effects and to make sure it's being used safely.
Right, so cautious optimism for now. What about those psychedelic therapies that are making a comeback? Seems like they're everywhere these days.
They are. Psychedelics, after being kind of pushed aside for decades, they're back in the spotlight for mental health research.
I was reading about how LSD and psilocybin, they were actually used in psychiatry back in the 50s and 60s before they got banned.
Yeah, there's a whole history there. And now, with more research and stricter guidelines, scientists are finding that therapeutic potential again.
Like we're opening up this treasure chest of knowledge that was locked away for too long.
Great analogy. Early studies are showing that psychedelics, when used in a controlled setting with therapy, they might really help with a bunch of mental health conditions: depression, anxiety, PTSD, even addiction.
I've heard stories of people having these profound mystical experiences on psychedelics that lead to big breakthroughs in therapy.
Yeah, there are a lot of those anecdotal reports. Researchers are trying to figure out how those experiences connect to the therapeutic effects.
Like maybe these substances shake up our usual ways of thinking and let us see things from a new angle.
That's the idea. But, gotta say it again, we need more research to know for sure how they work, the long-term effects, and any potential risks.
Cautious optimism strikes again. So what about that connection between inflammation and depression? That was a surprise to me.
It's a really exciting area of research, pretty new. For a long time, we saw mental and physical health as totally separate. Now we're realizing how connected they really are.
The mind-body connection is finally getting its due.
Right, and what we're finding is inflammation, the body's natural response to injury, it can affect mental health too.
But if inflammation helps us heal, how can it be bad for our minds?
Well, when it's chronic, ongoing inflammation, it can mess with different systems in the body, including the brain. And that chronic inflammation is linked to all sorts of mental health conditions: depression, anxiety, bipolar disorder, even schizophrenia.
Wow, so inflammation's like this sneaky villain messing with our brains in the background.
Good way to put it. This new understanding of inflammation opens up all sorts of possibilities for treatment.
Like what?
Well, anti-inflammatory meds, the ones used for arthritis and stuff, we're now studying if they can help with mental health too.
So the same meds that soothe achy joints might also soothe a troubled mind.
We're hoping so. It's early, but there are some encouraging results.
This is mind-blowing. It seems like we're entering a whole new era of mental health treatment, going after the root causes instead of just managing the symptom.
I think so. It's an exciting time for this field. I'm really eager to see what the future holds.
Me too. Okay, before we wrap up this deep dive, I think we should talk about something that often gets missed: stopping your medication.
You're right. It's super important. It's not as simple as just quitting cold turkey. You need to plan it out, do it gradually to avoid withdrawal and prevent your condition from coming back.
Yeah, I read that those withdrawal symptoms can be really bad, sometimes even dangerous.
It's true. How bad it is and what kind of symptoms, it all depends on the specific med, how long you've been on it, and just your individual body chemistry.
So what are some common things people might experience when they stop their meds?
Well, with antidepressants, you might get what's called antidepressant discontinuation syndrome. It can feel like the flu, dizziness, mood swings, can't sleep, weird dreams, even your depression coming back.
Yeah, one of my sources talked about that. Said those symptoms can be intense, and sometimes you might think it's just your depression returning.
Exactly. That's why it's so important to work with your doctor when you're stopping any psychiatric med. They can help you taper off slowly and safely to lower the risk of those withdrawal symptoms.
What about other types of meds? Do they have withdrawal too?
Lots of them do, yeah. Like if you suddenly stop benzodiazepines, the anxiety meds, it can cause rebound anxiety, insomnia, seizures, even delirium in severe cases.
Yikes, that sounds serious.
It can be. That's why you should never stop taking benzos abruptly when talking to your doctor.
And what about mood stabilizers, like lithium?
Lithium withdrawal is a bit different. You might not get that intense discontinuation syndrome like with antidepressants or benzos, but stopping suddenly can make your bipolar more likely to come back.
So again, it's all about that gradual tapering with your doctor's guidance.
Absolutely. The bottom line is don't mess around with stopping your meds. Always do it with your doctor's help.
Great advice. Now, in the last part of our deep dive, I'm really interested to talk about treating kids and teens with these medications. Seems like there's a lot to consider there.
It is a big topic and one that parents often have a lot of questions and worries about.
Yeah, for sure. Let's dive into that next. Yeah, this is definitely a sensitive topic. I mean, the thought of kids taking meds that affect their brains, that could be scary for parents.
I totally get it. You're talking about young minds and bodies that are still developing. You got to be super careful weighing the risks and benefits. And there's still so much stigma around mental health in kids, which makes it even harder for parents to reach out for help.
Yeah, that stigma is a real problem. Like, some people still think it's the parents' fault or a discipline issue, but that's just wrong. These are real illnesses. They need real treatment, just like any physical health problem.
Exactly. And just like with physical health, the earlier you catch it, the better. Early intervention can make a huge difference, prevent things from getting worse down the road.
So for parents who are facing this, their kid may be needing psychiatric meds, what are the most important things to consider?
First things first, a thorough evaluation by a qualified mental health pro. We're talking full medical history, psychiatric assessment, often some psychological testing too. Got to get the whole picture.
Like putting together a puzzle, got to have all the pieces to make the right decisions.
Perfect analogy. Once there's a diagnosis, the decision about medication, it's a team effort. Parents, the child if they're old enough to be part of it, and the doctor. Everyone needs to understand the potential benefits, the risks, and what the child needs and wants.
Finding that right fit for the kid, not just a one-size-fits-all approach.
Right. And it's so important to remember, meds are often just one part of the plan. Therapy, lifestyle changes, family support, those are all crucial too.
It's all connected, right? Mental health's not just about the brain. It's about the whole person, their life, everything. So what are some of the most common conditions in kids that are treated with meds?
ADHD, anxiety disorders, depression, and bipolar disorder, those are some of the big ones.
Okay, let's start with ADHD. It seems like every parent knows a kid with ADHD these days. What should they know about medication for it?
Well, first off, ADHD isn't just kids being bad or having behavior problems. It's a neurodevelopmental thing, a real difference in how the brain works, affects their attention, impulsivity, how much energy they have. Stimulant meds are usually the first choice. They increase dopamine and norepinephrine in the brain. Those help with focus, attention, impulse control.
But stimulants have side effects, right? That's a big worry for parents.
Yeah, side effects are always a factor. With stimulants, some common ones are like less appetite, trouble sleeping, upset stomach. Got to keep an eye out for those and adjust doses if needed.
What about addiction? I've heard that's a concern with stimulants, especially for kids.
I know, it's a common worry, but studies have shown that kids with ADHD who are on stimulants are actually less likely to have substance abuse issues later on.
Really? That's surprising. So treating ADHD with stimulants might actually protect them from addiction later.
It seems that way. It's counterintuitive, but it shows how complex this condition is and how important it is to treat it based on what we know works.
Wow, that's fascinating. Okay, what about anxiety in kids? Anxiety can be so hard for them, affects school, friendships, everything. What helps?
Usually, therapy is the first step for kids and teens with anxiety. Cognitive behavioral therapy, CBT, that's particularly effective. It teaches them to recognize and change negative thoughts and behaviors that feed the anxiety.
Like giving them a toolkit to handle their anxiety, deal with tough situations.
Exactly. And sometimes meds might be added, especially if it's really severe or if therapy alone isn't enough.
What kinds of meds are used for anxiety in kids?
Often it's SSRIs, the same ones used for depression in adults. They increase serotonin, which helps with mood and anxiety.
Are SSRIs safe for kids?
They're generally safe as long as they're used correctly with a doctor's guidance, but like all meds, there can be side effects, so close monitoring is key.
What should parents be looking for?
Common ones are nausea, headaches, trouble sleeping, maybe some agitation, and there's a rare but serious risk of suicidal thoughts or behaviors with SSRIs, especially in kids and teens. So it's crucial to watch for any changes in mood or behavior and call the doctor right away if anything seems off.
So, open communication with the doctor and careful watching, those are so important. What about depression in kids? It's hard to imagine them going through that kind of sadness and hopelessness.
It's tough, but unfortunately, depression is becoming more and more common in young people. The good news is it can be treated. Therapy and medication, they can both help manage the symptoms and improve their lives.
What kind of therapy works best for depression in kids?
CBT is a good one again. Helps them challenge those negative thoughts, build coping skills, become more resilient. Other types of therapy can help too, like interpersonal therapy, which focuses on relationships, or family therapy.
And what about meds? Are those same SSRIs used for adults? Also used for kids with depression?
They are, yeah. SSRIs are often the first choice, but same as always, careful use and close monitoring are key. Gotta watch for those side effects, especially the rare but serious ones like suicidal thoughts.
So careful, careful, careful. Got it. Okay, we've talked about ADHD, anxiety, depression. What about bipolar disorder in kids? That seems like a really tough one to diagnose and treat in young people.
You're right, it's a tough one. Bipolar is those extreme mood swings, energy levels, and behavior, going from the highs of mania to the lows of depression. It can be hard to tell apart from other things like ADHD or even just normal teenage moodiness. That's why you need a really experienced mental health pro to figure it out.
Once it's diagnosed, how do you treat bipolar in kids?
It usually takes a combination of megs and therapy. Mood stabilizers, the same ones used for adults with bipolar, they're often the main treatment. Help keep those mood swings in check, prevent both the manic and depressive episodes.
And do they ever use antipsychotics like they do sometimes for adults with bipolar?
Sometimes, yeah, especially if the child's having psychosis, like hallucinations or delusions, they can also help manage agitation and aggression, but they're used more cautiously in kids because of the potential side effects.
It sounds like treating mental health in kids and teens is a whole different ballgame.
It really is. You got to be super careful. You're treating a real illness, but you also want to minimize risks, protect those young, developing minds and bodies. It's a delicate balance.
Well, wow, we've learned so much today. We went from the basics of how these meds work to all the exciting new stuff that's coming up. It's been a real deep dive into psychopharmacology. Any last words of wisdom for our listeners?
I think the biggest thing is knowledge is power. The more you know about mental health and the treatments, the better decisions you can make for yourself or your loved ones.
You've definitely given everyone a lot to think about, and hopefully a lot of hope, too. There's so much we're still discovering about the brain and how to treat these conditions. The future of mental health is looking bright.
I agree. It's a really exciting time.
Well, on that note of excitement and hope, let's wrap up this deep dive. Thanks for being here. And to our listeners, remember, you're not alone on this journey. There are people, resources, support, all out there, ready to help. Keep learning, keep asking questions, and keep taking care of your mental health. We'll see you on our next deep dive.